Pain is something we associate with the human experience. From that first time you stub your toe, to that time you put your hands in boiling water, or that time you accidentally knock your forehead on the door, we feel pain almost every month in the year. Some people even have chronic pain that follow them for the rest of their lives. If we feel pain is so inconvenient, is there a way we can feel less pain? Or is there a way we can remove the painful sensations once and for all? So what is pain? There are many types of pain. We have the nociceptive pain, which is the common pain that you always refer to. This comes in the form of physical, chemical, and thermal damage to your tissues, which activate your receptors and send signals to your brain, causing a painful sensation. Then there is emotional pain, such as the loss of a loved one or bad grades. And then there is chronic pain, which originates from inside the body, which you have to get medications or have a surgery to remove it. To understand pain, which in this case I will refer to the nociceptive pain, which is the common physical pain that we experience daily. To understand it, we need to understand its mechanism. To fix something, you need to know how it works, right? So the first step in feeling pain is contact with a stimuli. So what is the stimuli in this case? Well, the stimuli can be a boiling pot of water or hydrochloric acid. The stimuli will come into contact with your tissue, and this is the first step. So you put your hand in a boiling pot of water. So this is the first step. The second step is the activation of your nociceptors or your pain receptors. So the boiling pot of water touches the upper part of your skin. And in this part of your skin, there is a lot of those pain receptors. The step 3 is the activation of these pain receptors. So the water touches the skin, damages it, and activates the receptors. The next step in feeling pain is the transmission of signals from the receptors to the brain. So when the tissue is damaged, these receptors get active and they transport some messages in the form of electrical signals to your brain. The next step is your brain processing those signals. So your brain receives the message from your cells, and then in the final step, it activates some chemicals to cause certain involuntary actions and the sensation of pain. So the involuntary action here can be you retracting your hand away from the stimuli or the source of the pain, which in this case is that boiling pot of water. So this happens in less than a second. So you touches it, you feel pain, and then you retract your hand. So that is the overall steps and mechanism of feeling pain. Having understood how pain is processed in our body, it is time for us to ask, how can we reduce pain or even eliminate pain? Well, I believe that by affecting any part of the pain mechanism, you can possibly alter the pain tolerance or the pain threshold. So let us start at the first step. So in the first step, we need a stimuli. So if you vary the degree or the severity of said stimuli, you can get different results. So for example, you have a 60-degree pot of water and a boiling pot of water, which is at 100 degrees Celsius. If you stick your hand into the 60-degree one, you will get better results than when you stick your hand into the 100-degree one, right? In the second step, you have the activation of the pain receptors in the affected tissue. So due to genetic or environmental factors, the amount and sensitivity of your pain receptors may vary. So for one person, their tolerance may be higher, and for one person, their tolerance may be lower. In a 2022 article named Pathophysiology nociception, and rare genetic disorders with increased pain threshold or pain insensitivity, the authors list a table of genetic diseases or genetic disorders that can cause symptoms from, painless on the tongue and limbs to general pain insensitivity to a much more extreme global pain insensitivity. In addition, there are some chromosomal deletions that can result in an insensitivity to pain. So that is the genetic factors that I am talking about. In addition, many research has shown that lifestyle and environmental factors can have an effect on your pain tolerance and pain sensitivity. So an article in 2021 titled "Pain Sensitivity is Reduced by Exercise Training: Evidence from a Systemic Review and Meta-Analysis." So this is a review paper that combines evidence from a lot of sources, and it confirms that by exercising, you have the ability to feel less pain. So that's kind of a superpower you gain through hard work and exercise, which is really great for your health, by the way. You can also feel less pain by changing how the chemicals in your brain and in your system interact to create pain. Your common over-the-counter pain medication like aspirin or acetaminophen, they interact with some chemicals. So I remember aspirin interacts with COX2, it binds to the COX2. So in a usual setting, COX2 will be released by the brain, I think. And so COX2 will produce prostaglandin, which causes you to feel pain. Aspirin binds to COX2, preventing the release of prostaglandin, and in turn causes you to feel less pain. Of course, you cannot be immune to pain by using aspirin alone, because if there is no prostaglandin, your body has other ways to make it, because you are still feeling pain, but it is greatly reduced and it is sold as an OTC pain medication as well. There are other drugs that works in different mechanisms, but the general way that these drugs work is that they interact with your brain and with the chemical it releases. Or you can take your local anesthesia, the thing that your dentist use, which is lidocaine. It freezes the nerves, essentially blocking the electrical signals from the skin, the nerves, to your brain. And this is a different kind of interaction, but it falls under the umbrella term of interacting with your brain and with your cells. So the final question to answer is that, should you try to feel no pain? Of course, there are very strong options for high-grade painkillers, but that must be administered by your doctors, and that is not available to you. So the only option you have is to get a very rare gene that allows you to feel no pain. In fact, this has been found in humans in a 71-year-old woman. She has a very rare mutation, and as a result, during her major surgeries, she doesn't feel a thing. And that's a bit weird because she can stay awake and talk to the doctors, I think. But I would not be happy if I have no pain, because believe it or not, pain is our first line of defense against injury and danger. So if you injure your hand or your limbs, or you have a cut in your head or somewhere, then the pain alerts you to that specific location that says, hey, get yourself treated immediately or it's gonna get worse. Without the pain, that wound will just stay there for weeks, months, even years, and then it festers and then you die, because you are still flesh and blood. Pain is your body's ability to protect you, and if you remove that, then it's not gonna go well. Just my 2 cents. So thank you for watching and have a nice day.